Hello, and welcome to the Abortion Basics video program. I'm Liz with Tough Topics, and this video program has 5 parts. Before we get to the basics, the biology, we want to tell you the powerful yet often untold story of policies protecting preborn life, championed by medical doctors, missionaries, and legislators alike throughout history. Then the basics. The reality is that before an abortion, there's a living human being in his mother's womb. The abortion ends that child's life, whether with pills or instruments. The abortion that you're going to see in part 3 is the same method that was used on a girl I knew growing up. She hid for 5 months that she was pregnant, and when she told her parents, they took her promptly for an abortion. This is a very sobering topic. After watching the video, please enjoy the role-playing scripts. Thanks.
In the 5th century BC, the founder of Western medicine, Hippocrates, said in regard to abortion, "To please no one will I prescribe a deadly drug, nor give advice which may cause his death, nor will I give a woman a pessary to procure abortion." In the 1st century after Christ, Christian missionary Barnabas said the following about abortion: "Consider now the way of light. These are the directions that have been given to us for this journey. Do not kill an unborn child through abortion, nor destroy it after birth." Around 100 AD, we have a record from an ancient Jewish historian, Flavius Josephus. The Mosaic law, moreover, enjoins us to bring up our offspring and forbids women to cause abortion of what is begotten or destroy it afterward. Ancient Greek, Jewish, and early Christian cultures all sought to protect the defenseless child in the womb. As Christianity spread throughout the world, so did legal protection for preborn life. Around 900 AD, King Alfred of England established a long-lasting legal system for his kingdom, which developed into common law. Common law was the forerunner to American law. Both British Parliament and the American government made abortion at any stage a crime. However, some world leaders enabled abortion. On November 20th, 1920, under the control of Vladimir Lenin, Russia legalized abortion. The public health announcement proclaimed a new, fully funded program for women, legalized abortions, available free of charge at state-run hospitals. This new pro-abortion mentality led to atrocious human rights violations in the name of eugenics and medical experimentation, particularly in Nazi Germany. After World War II, doctors from 27 countries around the world met in Geneva, Switzerland, to reaffirm their commitment to do no harm in the spirit of the Hippocratic Oath. "I will maintain the utmost respect for human life from the time of conception. Even under threat, I will not use my medical knowledge contrary to the laws of humanity." By the end of the 1950s, statutes in all but 4 states and the District of Columbia prohibited abortion however and whenever performed, unless done to save or preserve the life of the mother. Yet, on January 22, 1973, the cases Roe v. Wade and Doe v. Bolton established a constitutional right to abortion throughout all 9 months of pregnancy for virtually any reason. Roe allowed for states to restrict abortions later in pregnancy, however it required an exception for the health of the mother, and Doe defined health to include all factors, whether they be emotional, economic, psychological, familial, or physical. This decision has led to the killing of over 63 million unborn children by abortion, which is an average of more than 1 million per year in the United States since 1973. Each year, over 50,000 abortions are performed after 15 weeks of gestation, when unborn babies can feel pain. However, medical, religious, and legislative people around the world have continued to practice, teach, and make policy decisions which affirm the dignity of mothers and preborn babies. On October 22, 2020, heads of state from 36 countries signed the Geneva Consensus Declaration, stating, "We, the representatives of our sovereign nations, reaffirm that there is no international right to abortion, nor any international obligation on the part of states to finance or facilitate abortion. Less than 2 years later, on June 24, 2022, the Supreme Court of the United States handed down its Dobbs v. Jackson decision, stating, "We hold that the Constitution does not confer a right to abortion. Roe must be overruled, and the authority to regulate abortion must be returned to the people and their elected representatives." With this authority comes the responsibility to be informed. Informed about life in the womb, and informed about abortion.
In the tapestry of human life, behold the first small thread, a single ovum cell. Seen here, photographed only moments after conception, this product of a male sperm and female egg marks both the beginning of a new life and the genetic future that life will experience. From this point on, every aspect of the child to be, height, color of eyes and hair, the capacity to think, learn, and speak is established. Within 30 hours, this remarkable new cell begins to divide. As the hours pass, 2 cells become 4, then 8. Each new generation of cells repeatedly doubles in number. The process continues to accelerate, and by the 6th day, the rapidly developing embryo is ready to attach itself to the mother's womb. After 2 weeks, the embryo is barely 1/10 of an inch long. Its cells are now organizing according to type and purpose, and already the beginnings of a head and brain are established. By the 35th day, the foundations for the spinal cord and nervous system are in place. The heart begins to beat. And from this point on, it will regulate the life of the tiny being, no larger than a drop of water. At 6 weeks, the embryo is 3/5 of an inch in length. The offshoots of legs and arms are now visible. Mouth, ears, and nose begin to appear. Two months have passed. Though only an inch in height, the child is now a well-proportioned, small-scale baby, 40,000 times larger than the egg from which it grew. Every organ is present. Fingers and toes have formed, and slight movements are possible. Day after day, millions of carefully orchestrated decisions are carried out, and the child takes shape. Thousands of years before images like these were ever seen, the Hebrew poet David expressed the wonder of life's beginnings in a psalm of praise to God. You created my inmost being. You knit me together in my mother's womb. My frame was not hidden from you when I was made in the secret place. I praise you because I am fearfully and wonderfully made.
My name is Dr. Kathy Altman. I'm a board-certified obstetrician gynecologist with almost 33 years of experience, and I've completed over 500 abortions. Today I'm going to describe a second trimester surgical abortion called dilation and evacuation, or D&E. A D&E is generally performed between 14 and 22 weeks of pregnancy. Before a D&E abortion can be done, the cervix must be dilated slowly over 1 to 2 days with laminaria or a similar product. Laminaria is a type of seaweed that absorbs water and swells to several times its original diameter. When the woman undergoes the evacuation portion of the procedure, she lies on a table with her legs in stirrups. She may be given injections of local anesthetic in the cervix, IV conscious sedation, or general anesthesia. The abortionist uses a speculum to open the vagina and uses an instrument to stabilize the cervix. Metal dilators may be used to further open the cervix if needed. Once the cervix has been stretched open, a cannula attached to suction tubing is placed inside the uterus. The suction machine is then turned on and the amniotic fluid surrounding the fetus is suctioned out. The fetus is too large to fit through the cannula, so he or she must be removed in pieces with a clamp such as this Sofer clamp. A Sofer clamp is made of stainless steel and is about 13 inches long. At the tip, there are rows of teeth for grasping. The abortionist reaches into the uterus with the clamp and tries to grasp an arm or leg. Once the abortionist has a firm grip, she pulls forcefully in order to remove the limb. Piece by piece, the abortionist removes the arms and legs, followed by the head or the body, including the torso and pelvis, along with the intestines, the heart, and the lungs. The placenta is also removed. If the cervix has been overdilated, the body or even the entire fetus may be pulled out intact. Usually, the most difficult part of the procedure is extracting the fetus's head, which at 20 weeks is about the size of a large plum. The abortionist must open the clamp widely to grasp the head, and then crush it so that it will fit through the cervix. The abortionist knows he has crushed the skull when a white substance, the fetus's brains, leaks out through the cervix. The abortionist then removes the compressed head. Any remaining limbs, organs, bone fragments, or pieces of placenta not removed with the forceps are removed by scraping the uterine lining with a large curette or by reinserting the suction cannula. The abortionist then reassembles the fetal parts to make sure that there is nothing left inside the uterus, which could cause infection or bleeding. Once all the parts have been accounted for, the bleeding has been controlled, and all the instruments have been removed from the vagina, the abortion is considered complete. For the woman, this procedure carries a risk of major complications, including perforation or laceration of the uterus or cervix, with possible damage to bowel, bladder, or other maternal organs. Infection and hemorrhage can also occur, which can lead to death. Future pregnancies are also at an increased risk for loss or premature delivery due to abortion-related physical trauma and injury to the cervix. As I mentioned at the beginning, I used to perform abortions. At the time, I truly believed I was helping women. After the birth of my daughter, however, I realized that abortion doesn't just end a pregnancy, it kills an innocent human being. Such terms as zygote, embryo, or fetus are simply terms that refer to age, like infant, toddler, and adult, and do nothing to diminish the humanity of the child. As I cared for women in my OBGYN practice, I also learned how abortion harms women. I stopped doing abortions because I could no longer kill babies just because they were unwanted. I am now a pro-life advocate. I am proof that anyone can change, no matter who they are or what they've done. I invite you to join me and make a decision to protect the preborn. Thank you for watching.
These are the tools of the abortionist's trade. In a few moments, this little boy's life will be summarily extinguished with these instruments. The cervix has been sufficiently dilated, and the bag of water is broken. The umbilical cord has been severed, the lifeline cut and and collapsed. Now it is being wrenched free of the child's body. And now the abortionist is reaching into the uterus with the grasping instrument to dismember the child. Piece by piece, the extremities are pulled away, then portions of the back, the spine, and the torso. A portion of the chest and abdominal wall has been torn from the body. The ribs are easily identified. Can anyone doubt this child has experienced an unimaginable agony? Pieces of the torso are being removed, and the parts are stacked on the table to the side of the abortionist in preparation for reassembling the child to assure that the abortion has been complete. In this pathetic pile of human rubble, we can discern a leg with the foot still attached. The head is located, and having been located, is grasped in the jaws of the clamp. The clamp crushes the head, and the head is then removed in pieces. The crushed head has now been removed, and the white matter of the brain has spilled out. After the procedure has been completed, this instrument, a curette, is introduced into the uterus. This curette is used to scrape out all the fragments and the shards of the afterbirth and the child which remain, and the procedure is then at an end.
It was my ex-husband and myself who aborted my second child. And, you know, for him, he was able to just say, you know, let's just forget about it. You know, I don't want to make sure nobody knows about this at my workplace. I don't want anyone to know. So it created so many anger issues within me because he could forget about it. My current husband, I was having anger issues towards him, and I had no idea why I was mad at him. I was just angry with men because it was an easy out for them, and I had to deal with it.
Within 3 years after my abortion, I was good as dead. With the drugs I began to use, with my sexual promiscuity, I was done. I was through.
Immediately after that abortion, I started self-destructing. And so after about 10 years of that, I'm feeling like I'm losing my mind. And I ended up going to a psychiatrist. Because I was scared to get out of bed in the morning. Basically, his answer for me was, you just gotta let go of this guilt.
I became depressed, anorexic. I had a deep depression. I tried to commit suicide twice. So I just wanted to destroy myself.
Is it possible that abortion leads to mental health issues?
The American Psychological Association has twice, during the Coop Report and then more recently, reviewed the entire world's literature on abortion and mental health. And their conclusion is that there is no evidence that having an abortion impacts a woman's mental health.
Liar.
Denise Mountenay is the founder of Canada's Silent No More. She became a vocal pro-life lobbyist because of the psychological damage, pregnancy complications, and breast cancer she experienced after her abortions.
What did you think abortion was?
It was just an operation, and I would be unpregnant. I was 16 the first time I found out I was pregnant. When I told my mother that I was pregnant, she said, "Oh, Denise, honey, you're only 16. She said, "You have your whole life ahead of you." She said, "Why don't you just come with me and you can have this operation and just forget about it and get on with your life." So I thought, oh, it's okay with my mom, it's okay with the government, it's okay with the doctors. So I thought it must be okay. The nurse said, "Oh, do you know why you're here?" And I said, "Yeah." And she said, "Okay, come with me, put on this gown." We went down a long, long corridor, and I think I know why there was such a long corridor between the reception area and where the actual abortions took place, because you sure wouldn't want to hear the screams
of the girls having abortions. And sorry, but sometimes I get flashbacks and I kind of relive. And when it was over, I curled up into a fetal position and I thought, that's it. I can't speak. I can't talk anymore. And I went into some kind of shock. I ended up getting an infection, damaged cervix, badly scarred uterus, and I had a lot of complications. I suffered many years just hating myself and feeling horrible. It was just very traumatic, and then I thought women need to know the truth about what an abortion really is and what it's doing to women.
But when I began to share for the class, it's like vomiting almost. It's like you get sick, you push it down, and then all of a sudden it all comes out. And I know this is kind of a weird way to think about it, but when you throw up, you feel better after you throw up. Well, for me, it was like getting rid of all of that and letting it out for the first time. And all of this weight just came off of my shoulders and I could start to begin to feel the freedom. And one of the most amazing things is to see, after I share a story and I walk away from the microphone, to have someone come up and just, I've done what you've done, and you just give them a hug and you hold them, and it's the first step for them.
I was that woman, and you were on the other side. There was no words spoken, just pain, and that hug changed my life. And that is our hope, you know. Moving forward, it's nothing but love. There's no judgment. Yes. Nothing but love. We just want that hug.
Hello, and welcome to When They Say, You Say. My name is Olivia Gans Turner. I am your hostess for this 5-episode production that's really all for you. It's a production that's been developed specifically with our audience in mind. Individuals like yourselves from all over the country who are interested or want to learn more about how they can actually effectively and positively present the pro-life message anywhere and at any time. It's something that those of us at the National Right to Life Committee developed a few years back when we realized that there were many new people coming into the movement, people who had not had opportunities to study the issue, to confront different kinds of individuals, to speak before different audiences, and yet there was this great desire to do this and do it well. So our goal was really to create something specifically for those of you watching, those of you who have joined us, and I hope will stay with us for all 5 episodes. Because truly, when you begin, you don't want to stop. You want to maintain and develop and grow in your ability to be a voice for the voiceless. Now, in order to do that well, I need to help you understand that this entire concept is about communication. If we're not communicating effectively as pro-lifers, then we're not doing our job. It's simply not working. So for me, communication has certain factors that are essential. Communication means that I'm working with someone else. I'm in connection to someone else. I'm respecting the other. I'm really concerned about the other's point of view. I know what my point of view is. I know that scientifically a baby needs to be protected under the law, that all unborn children have beating hearts as early as 18 at 20 days, that they have brain waves by 6 weeks, that they can feel pain at 20 weeks. I know that this is a member of the human family, but the individuals I'm speaking to may not know what I know. So for me to communicate, I have to care more about their understanding or perspective than I do about my own facts and figures. That's the truth. We are really out not only to save the lives of the babies, but we as pro-lifers are trying to save everybody's life, because we understand that if one group of human beings can be disposable, all of us find our lives forfeit. It's true that many people in our society don't understand this risk or what's at stake in the debate, And they think it is just about unborn babies. But you and I know it's a much bigger story and a much bigger picture. So as we work together to save lives, we have to realize that there are a couple of things that we always have in our grab bags of tricks, if you will, that make us more effective communicators. You want to know what I think the number one tool is that you have with you all the time? I've been talking about it one way or another. It's your ears. Your ability to listen, and to listen well, will make you a truly effective communicator. Because if I can authentically and really hear you and your concerns, your fears, your anxiety, your stress about any element of the pro-life debate, I'm probably going to give you a better answer. I'm going to give you a more accurate and appropriate answer to meet your needs, and probably convince you a little bit faster of the validity of the pro-life argument. Now the second part of that listening is active listening. When I'm watching you and looking at you, eye contact and a smile really allows me to connect to you very quickly and much more directly. I'm actually notorious when I'm on a university campus for speaking very specifically and directly to any particular student who's talking to me at that moment. At that moment, the rest of the room is invisible to me. Only that student who's asked me the question matters in that moment. And it's that opportunity of connecting authentically and totally to another person that very often can make or break the success of a pro-life communicator, as far as I'm concerned. We talked earlier in the first part of the show, welcoming all of you to be a part of this extraordinary new idea and way of thinking about pro-life arguments. Also means thinking about the words that we use. We talked about how important the words were, that they actually amount to 10% of the message that you get across to whatever audience. That's why commercials are planned the way they are, because it's just that little tiny jingle that stays in your head. 10% are the words that actually say, that you say. Now that can frustrate pro-lifers, because pro-lifers have a wealth of knowledge. We're often very well read, we've studied scientific information, we have access to maybe philosophical or theological arguments that are relevant from our perspective or our position in life, and we want to bring all that forward in the conversation. But I'll tell you this, if you overload the conversation with everything you know, then you're not communicating well and effectively to the people who don't know all that you know and may never know it. But what they want is for you to answer their questions, to answer them specifically and to answer them concisely. So the words become important. And words do have power. That's why the pro-abortion organizations across the country so effectively use certain words, because they know from polling and other experiences that they've had that those words seem to resonate with the American people. Now, it's up to you to figure out which words resonate with the average American on our side. Let's start with the first big word. You're going to see a graph on the screen that's going to walk you through some of the words and some of the ideas that go along with these words. The number one word that you can't use if you are a pro-lifer is the C word. The C word is choice. You can't use that word because, like I just said, the pro-abortion side has studied this and studied as well. They know Americans like having choices. They know Americans appreciate that they can live where they want, go where they want, have the job they want, virtually do anything they please, see the movie they want, all of these things that we appreciate about the independent and free living lifestyle of American society. That's great, except we don't want to legitimize a choice that ends the life of a living human being in the womb. That's not acceptable. So when we use the word, the C word, we're actually continuing to validate that. And many times pro-lifers aren't aware of how much the debate, the ideas have seeped into our minds and the way we use words without even realizing it, that may dehumanize or take away the power of our pro-life message. The C word is one of them. What can you use instead? There's lots of possibilities. The way that I usually deal with this is to say when a woman is pregnant, she has many options to consider. There are a variety of life-affirming decisions she can make that will protect her and her child. There are different courses of action she can pursue that don't involve harming her body and killing her child. All of these are appropriate ways to replace the C word. It's a lot of fun seeing how many ways you can come up with to compassionately and accurately replace the C word. The next big word that you really cannot use, because it completely, unfortunately, in our modern society now dehumanizes the unborn child, is the word I call the F word, fetus. I know some of you are really proud of the fact that you understand that that is a Latin word in origin and that it simply means young one of self or little one. And that's true. That's totally true. And if you're in a conversation where you have time to maybe explain that definition, great. I'm very often on the news or on a radio program or something where I only have 10 seconds, 30 seconds to get the message across. I have only a few moments to convey the humanity of the unborn child. So we never use the word fetus. We talk about unborn babies, preborn babies, babies in the womb. We talk about babies before birth. All of these ways that help us create an image, because as I said earlier, 60% of the message is what it looks like. With your words, you can create an image that immediately sends a message to the mind of a beautiful, precious, unborn child, definitely in need of protection under the law. So that's your job. Along with that, all of us were somebody from the moment of conception. We were either boys or girls. We were either going to be short like I am, or tall like some of you are, or need to wear glasses like I do, or have red hair or black hair. All of those factors about our genetic reality was in place from the moment of conception. Most importantly, our sex was in place. From the very beginning, we are either boys or girls, male or female. So never use the word it to refer to the unborn child. Always use one of the two pronouns. Some people like using she because, of course, the argument often centers around the idea of it's her body, it's her C word, her decision. But in fact, that's a good argument to say she. No one is talking to her, the girl in the womb, whether or not she wants to live or die. That's perfectly fine. But sometimes perhaps a better pronoun is he, because it's absolutely impossible for a male child to ever, in any context, be part of a mother's body, a woman's body. It's not physically possible. So immediately, in one word, you have conveyed the significance and unique quality of this unborn child and their humanity. Now, other words that I think are important that you need to be aware of in our short time together are who has an abortion. Women have abortions, right? No. Mothers do. I'm someone's mother. Unfortunately, on February 27, 1981, I made the decision to abort my child. I know that I will always be that child's mother, and I made a decision for my child that was a deadly decision that has left me with issues and memories and factors in my life that I will always be dealing with in one way or the other. So I made a permanent decision, like every parent does for their children. My decision was a poor one. So it's not an issue of a woman against her fetus. These are mothers making decisions for their children, either poorly or with assistance that give them life. So this is important. Another word that comes along there that follows on that one is who does abortions. Doctors and physicians don't do abortions. Abortionists do. It's important that we take away the idea that there's something acceptable or something appropriate about the behavior of individuals who are trained to be medical healers who now participate in this ugly and deadly experience, this violence of abortion. So always refer to them as abortionists. Secondarily, where are abortions performed? Now this is important. Many of you feel strongly about using words that in some way even show how much uglier the abortion experience is. You might use words like abortuary or abortion mill or abortion chamber. I understand there's this need to try to convey the graphic, ugly character of abortion to our society. But again, remember our purpose here. It's to communicate. It's to communicate and invite, to draw people to our efforts, not to push them away. And if the words that I use make me seem like something kind of odd or strange or a little weird to the people listening to me, I haven't been an effective communicator. We never refer to abortion clinics or hospitals that perform abortions. As a rule at National Right to Life, we use the term facility. Because when you go to a hospital or clinic, you expect to get treatment and to walk out healthy and well, hopefully. But in the case of an abortion facility, someone always dies and someone else leaves wounded or maimed for life. So these are important things to consider. Now, who are you? In this conversation, we have to ask the question, who exactly are you? Are you an anti-choice person? Are you one of these truly awful anti-woman people? No, you are pro-life. You are, in fact, you are working to save as many human lives as we can from the violence of euthanasia, infanticide, as well as abortion. In that one sentence, I've recaptured and redefined the debate. I started at the other end of where the pro-life movement has always seen its effective role. National Right to Life has always been involved in the comprehensive discussion of how to protect not only the unborn and their mothers from the violence of abortion, but always the idea that we would have to be, as an organization and a country, involved in protecting the elderly or those with disabilities or those who have disease that cannot be treated any other way. So it's good to have one sentence that can turn the debate around, I think. Another word. So you are always pro-life. You are always working to protect innocent human life. They are always anti-life or pro-abortion. Anti-life in the case of people involved in perhaps physician-assisted suicide or other programs like that or efforts like that. When it comes to abortion, they are always pro-abortion, and you are always pro-life. And redefine it. If someone calls you anti-abortion, redefine it. Say, no, I don't think you understand who I am or what I work with or what we represent. Let me explain that what the pro-life issue is to you, what I consider myself to be as a pro-lifer. Important, important, important. Now, what are you trying to do? You are trying to pass protective laws, not restrictive laws, not laws that outlaw or ban abortion, but rather laws that are protective, the most protective laws possible. Moderate and reasonable laws. Laws like parental involvement laws, which overwhelmingly 83% of Americans support. Laws like women's right to know laws, which over 90% of Americans support. Laws that would guarantee that mothers and fathers are told before their minor-age daughters get an abortion. Or laws like women's right to know laws that recognize that women getting an abortion, a mother walking in, has to be given full information before that abortion occurs. So, knowing who you are is a big part of the debate. Let me get to the one big last word that I think is critical here. And by the way, all of the information we're presenting during the series is available from nrlc.org. That's the National Right to Life Committee's website, nrlc.org. We will provide you with the packet that covers all of this information. The final big word that I think is important for us to talk about, and this may jar some of my watchers and my viewers. What do you think abortion is? Many of you watching are going to answer me right now and say abortion is murder. And I understand that sentiment. I know where you're coming from. We don't refer to abortion as murder at National Right to Life for the simple reason that, unfortunately, tragically, horrifyingly, abortion is legal in the United States of America. Murder is a legal term. It has legal connotations. Most horrifically, since Roe v. Wade in 1973 and Doe v. Bolton, the companion decision, abortion has been legal through all 9 months of pregnancy throughout the majority of the United States. That's quite terrifying to ponder. What is abortion? Abortion is always a deliberate act that kills an unborn child. It is always killing unborn children. And the reason I bring that up is that, again, if someone I know that I'm talking to understands the legal concept here, they're not going to be listening to me anymore if I insist that abortion is murder. The other phenomenon that I need you to realize is that, once again, let me remind you, you may very well be talking to me, that woman who's had an abortion, that woman who is in need of healing, who is in need of an opportunity to know the peace and forgiveness that may be available to me when I find the appropriate counselor or pastoral care, that I can heal from the hurt that I live with on a daily basis. If I hear you accusing me of murder, that conversation will be over. For all of these reasons, I want you to be aware that the words that we use matter, because we're always talking to someone who has a story of their own, someone who has experiences that you don't have, that I don't have. They have knowledge about different problems, perhaps families who've given birth to disabled children, or individuals who've dealt with other crises like rape or incest in their family story, or perhaps they've had a relative lose a job because they're pregnant, or they're working with the poor in their community and they're troubled by how we're helping all of these things. All of these issues and subjects can be addressed, and addressed respectfully, accurately, and lovingly. If you want to learn a bit more about how to do that, and our method, I hope you'll join us for the next episode of When They Say, You Say. I'll be here. I hope you will be too.
Dei Genitris, Signum Magnum, in hoc Signum vinces, conturgibus, subtum presidium, quam